Hello, and welcome to the Cardiology Department here at the University of Florida Health, Jacksonville, Florida campus. My name is Sebastian Carrasquillo.
I'm Pujan Patel.
And we're this year's Cardiology Chief Fellows.
Thank you for your interest in our General Cardiology Fellowship Program.
We wish you could be here with us today, but given the global pandemic, we have adopted to virtual interviews this season.
Over the next few minutes, we'll be giving you a virtual tour of our cardiovascular department.
You'll also have an opportunity to meet our current faculty and fellows.
This is our continuity clinic, our ambulatory clinic area where we spend an afternoon once a week seeing patients. Also, the subspecialty clinics take place here. Fellows typically spend 2 months during their first year of fellowship. First year fellows will spend half a day scanning with expert sonographers, learning how to read high-quality images while spending the other half of the day reading with the upper-level fellows and attendings. In the Echo Lab, routine TEs are done for evaluation of valve and structural valve disorders.
This is the Nuclear Stress Lab reading room. General cardiology fellows spend a minimum of 2 months rotating in nuclear cardiology during fellowship. Fellows are able to work with nuclear radiology and cardiology faculty, creating a unique learning opportunity. In the lab, we perform exercise and pharmacological myocardial perfusion imaging, thallium viability studies, and exercise treadmills.
Our cath lab is a large Northeast Florida referral center for high-risk percutaneous coronary interventions with renowned leaders in various areas of interventional cardiology. Our general cardiology fellows spend a total of 12 weeks rotating the cath lab. Fellows perform a variety of procedures including left and right heart catheterizations, coronary angiograms, and additional structural procedures. Our EP lab is a robust lab. Our general cardiology fellows spend a total of 12 weeks throughout their fellowship rotating in EP. In the EP lab, fellows get exposure to a variety of procedures such as defibrillator placement, pacemaker placement, loop recorder placement, ablations, and tilt table studies.
The University of Florida Jacksonville campus CCU is composed of a 24-bed critical care unit. Fellows will typically spend a total of 4 months caring for the most critically ill cardiology patients.
I think what sets us apart from many programs across the country is that we have not only the diversity of the population and the pathology that we see, but the diversity of the faculty, their involvement in their education.
The thing that I like the most about this program is the hands-on experience that you get right out the bat. Your exposure that you get in the cath lab and the EP lab, and as well as the non-invasive and the echo lab, I feel like is something that you will not find somewhere else.
I think it's a very special place, a very good place for you to continue your academic career, and we will do everything we can along the way to foster your development in whatever area you're interested in within the realm of cardiology.
Proper training, proper education, because here there's a nice combination of just clinical training and also lectures where we're able to kind of combine both together and learn to become good clinicians. And also they have great research expertise here, and so if you want to combine everything together, that works great here.
In essence, we have a robust teaching program that is geared to deliver exceptional educational experience for all the prospective fellows.
One of my favorite things about the program here is honestly just the overall culture. We've got a great level of collegiality. The fellows get along really well. And then that relationship even extends to the attendings. We have their direct cell phones and they'll pick up a phone call from us any time of the day, give us good feedback. We have a lot of great mentoring as well.
We like to have a very open relationship without any filter, without any limit on the possibility to speak about problem, to discuss about problem, and to try to solve problem.
They make sure that they're preparing us well through the academics. They make sure that all of our time is protected, try to show us as much as they can to prepare us.
I was looking for somewhere where the faculty, there's female faculty who can be mentors to me, not just as a cardiology fellow, but also as mothers, and I've had that here.
One of the biggest things that I always look for a program during cardiology fellowship or during residency, I always look for a program that shows me the value of family. I come from a Hispanic family, so family is always very important for me.
I mean, we're intimately involved, mentoring is close. We are sometimes suffocating in a very nurturing way, and that sets us apart.
We have a very active and vibrant cath lab with faculty with different areas of expertise where we perform a large number of complex interventions with a broad variety of cases.
I'll teach you all the flavors, all 38 flavors, and you'll be very good at knowing exactly when to do the right test at the right time for the right patient.
So we're able to offer the general cardiology fellows a multifaceted approach to our electrophysiology services and program. Included in that approach is a sectioned out schedule per week of dedicated laboratory time where the fellows have hands-on experience.
Superb clinical training ground. We have a diverse faculty and a diverse group of trainees. We have been accredited for 33 years, and that only bespeaks the strength and the robustness of what we offer.
Definitely a great training ground.
Jacksonville's a really big city with a lot going on, a lot of different neighborhoods. And I think that's one of the things that I appreciate about it the most. You can find something to do any weekend of the month in any different part of Jacksonville, whether you like being outdoors at the beaches, eating at nice restaurants, movies, theaters.
We think that this is a kind of family because we spend the majority of the time here.
For the cardiologists of the future, and simply just a great place to do a fellowship and also to live here in the city of Jacksonville.
I think this is a wonderful program. I have a 25-year perspective here, and I just think it's a great place for you to come, do your training in a wonderful city with a lot of great people.
Having a place where the outside is wonderful and then you come to the inside quarters of where you train, and having world-renowned thrombosis research, if that's what you want to do, to the clinical and the bedside teaching in our wards or in our coronary care unit. I've said it many times, the clinical experience that you get is unique because of that. You have an amalgamate of expertise and diversity of pathology and of faculty, and you couldn't have a better combination.
Thank you for joining us on our virtual interview program.
And good luck with this year's interview season. If you have any questions, please feel free to reach out to us.